This is Lab 2, study of bones. We'll cover the vertebral column plus the appendicular skeleton. Station 1 is the cervical vertebra, C1 the atlas. This is the atlas. This is a superior view. The atlas has lateral masses. It has no body, but two lateral masses, which is where the articular processes sit upon. There's a superior articular facet, which you see is elongated, versus the inferior articular facet, which is much more circular. Note the shape difference. There's an anterior arch and a posterior arch. The anterior arch has the articular facet for the dens. The posterior arch has the posterior tubercle and also the groove for the vertebral artery. There's a transverse process, and the vertebral artery travels through this transverse foramen. All cervical vertebrae have a transverse foramen. The next vertebra is the axis, C2. You can see how it looks much different than the atlas. It has this very prominent projection, projects superiorly, called the dens or the odontoid process. We have the articular facet here for the transverse ligament of the atlas, plus the articular facet for the anterior arch. The dens, which the whole thing is called basically the axis. The axis has a lateral mass on both sides and a body. So there's two lateral masses and a body on the axis. Note the bifid spinous process and the transverse foramen. Cervical vertebrae have certain characteristics that are unique to them. We have two types of cervical vertebra, the typical and the atypical. The atypical include the atlas, the axis, and C7. C3, 4, 5, and 6 are typical. Characteristics of cervical vertebrae include a bifid spinous process, transverse foramen, a costotransverse bar, also called costal lamellae, an anterior tubercle and posterior tubercle, uncinate processes, which are these projections here, C7, which is called the vertebral prominens, looks much different. It is atypical. Notice a very prominent spinous process. This is called the vertebral prominens. The transverse foramen again. Note that on C7, the vertebral artery does not run through this hole. The vertebral vein does, but the artery doesn't. The artery runs through the transverse foramen of C1 through 6, but not through C7. Thoracic vertebra, which is our next set. Notice this is a typical thoracic vertebra. Notice no transverse foramen. There is a transverse process, but no transverse foramen. The costal facets, which are found on thoracic vertebra, are these facets for the ribs. There's a transverse costal facet, a superior costal facet, and inferior costal facet. They're oftentimes called demifacets, or half of a facet. Notice the articular surfaces of the articular processes and facets. They are on a coronal plane on the thoracics, both the superior and inferior. These are the superior articular facets. These are the inferior articular facets. We have the pedicle, the lamina, the spinous process, the vertebral foramen. The two pedicle and the two lamina form an arch called the neural arch. Lumbar vertebra look much different than thoracic vertebra. And I'm going to show you a couple vertebra here just to kind of give you an idea. This vertebra is a thoracic vertebra. I know that because of the shape and the line of the articular facets. They're on a coronal plane. Now it looks like a lumbar if you look at it, big body, but they are thoracic. This is a lumbar. Notice that the articular facets of this vertebra are on a sagittal plane. The articular surfaces of these facets are on a coronal plane. Lumbar vertebrae have several structures to them. They have a transverse process. They have a superior articular facet, which faces medial, an inferior articular facet, which faces laterally. Okay. On the transverse process, there's a little accessory process where the transverse process joins the superior articular process. That's called the accessory process. And then on the superior articular process, there's actually a process called the mammillary process. This is mammillary process. This is the accessory process right here. The portion of the lamina between the two articular processes, this is called the pars interarticularis, or the part between the articular processes. Again, note the angle of the facets on the lumbar versus that of the thoracic. On the sacrum, this is a sacrum. There's 5 vertebrae fused together on this. We have the sacral foramina, which is, you have the anterior sacral foramina and the posterior sacral foramina. The sacrum has lateral masses, which is the fusion of the transverse processes of all the sacral vertebrae. It's 5 vertebrae fused into one. You can see the transverse lines, which is where the intervertebral disc used to be, but now it's fused. The lumbosacral angle is the angle between the last lumbar vertebra and the first sacral vertebra. So if we have a line drawn between the anterior aspect of this and of this, that's the lumbosacral angle. The sacral canal is the neural canal where the spinal cord, actually not the spinal cord at this level, but the cauda equina is. The spinal cord ends at L1 in humans, but this is where the cauda equina is. Then we have what we call the median sacral crest, which is the fusion of the spinous processes of the sacral vertebrae. On the manubrium, we have a manubrium. We have 2 manubria here. Let's get this one. We have the jugular notch, which is on the superior aspect of manubrium. We have the clavicular notches for the clavicles. Then we have the costal notches for the ribs. The manubrial sternal joint is a joint between the manubrium and the body of the sternum. It forms a line there. This is called the manubrial sternal joint, sternal angle, or angle of Louis. And then there's a xiphoid process on the distal aspect of the sternum. So the body, so you have the body of the sternum, manubrium, body, and xiphoid process. And the xiphoid process is broken off of this pretty much. Next we'll cover ribs. This is a rib. The 2 components of the rib you need to know is this is the head of the rib. And if you look at the inferior surface, there's this groove. So to tell a right from left rib, and from now on, from all the bones we're going to talk about, ribs included, and bones of the appendicular skeleton, you must tell me right from left. How to tell a right from left rib is put this groove inferior, this head posterior, and if we do that, you can see this is a right rib. A right rib. What lies in this groove is the intercostal artery, vein, and nerve. The vein, artery, and nerve lay right there. Our next bone is a clavicle. This is a clavicle or collarbone. If you notice it's kind of got a bend in it, has this kind of bend to it. This is the medial aspect or the sternal end. This is the lateral aspect or the acromial end. And you can see the sternal end kind of flares outward where the acromial end is more pinched flat. Now the secrets of telling rights and left clavicles are this little bump called the conoid tubercle. The conoid tubercle always goes inferior and posterior. So if I put this inferior and posterior as it relates to me, this would be my left clavicle. Again, acromial end, sternal end, conoid tubercle, and there's a groove for the subclavius muscle right here. All right, our next bone we're going to talk about is the scapula. This is a scapula. This is the posterior aspect of the scapula. Telling right from left on this bone, again, this is the spine of the scapula. This is the glenoid fossa. This is the acromion. And if you look at this is posterior, this is inferior, this is lateral, this is medial. So this would be my left scapula, a left scapula. There's a couple fossa here. This is a spine, so this is called the infraspinous fossa. This is called the supraspinous fossa. And on the anterior side, we have the subscapular fossa. We have the superior border, the superior border with this notch called the notch for the suprascapular nerve or suprascapular notch. We have the medial border or vertebral border, and we have the lateral border or axillary border. The angles, this is the inferior angle, and this is the superior angle. Again, this is the glenoid fossa, and then this structure here is called the coracoid process. Coracoid with a C. And the way you remember that is scapula has a C in it, which makes it easy to remember that that's the coracoid process. Our next bone is the humerus. This is a humerus. Maybe getting out of the aspects of ranges of our little video here, but this is a humerus. This would be a left humerus. Okay. And this is the head. This is the proximal aspect. This is the head. The anatomic neck is here. The surgical neck is here. This is the greater tubercle. This is the lesser tubercle. And this will be the intertubercular groove. This is the deltoid tuberosity. We have a groove called the radial groove. You can see this, the radial groove or musculospiral groove. We move distally, and this is the medial epicondyle. This is the lateral epicondyle. We have a lateral and medial supracondylar crest. We have a trochlea. From here to here is a trochlea, and this is the capitulum for the head of the radius. This is for the ulnar, the semilunar notch of the ulna. On the posterior aspect, also here we have a coronoid fossa for the coronoid process of the ulna. On the posterior aspect, we have an olecranon fossa. And notice posteriorly, you can just see the trochlea. You cannot see the capitulum posteriorly. You can see the capitulum anteriorly and trochlea, posteriorly just the trochlea.
Right from left.
Again, this is a left humerus. Our next bone is the radius and ulna, and we'll do the ulna first. Here's the ulna. Okay, you can tell it's an ulna, very obviously. It has this olecranon, which is your elbow bone. It has a notch called the semilunar or trochlear notch to articulate with the trochlea of the humerus. This is called the radial notch. Now, if you look at the ulna, you put the olecranon proximal, the semilunar notch anteriorly, and then whichever side of the ulna, if you hold it in your hand, this notch, the radial notch is on, it is that ulna. So this actually is a left ulna. And if I put it to you like you would be looking at it, here's the olecranon, semilunar notch, and there's a radial notch. It's on your left-hand side. That makes that a left ulna. Also, we have the interosseous border, and then the styloid process of the ulna. On the radius bone, this is a radius bone. Again, this is the head or proximal end, this is the distal end. The head is rounded. That fits in that radial notch of the ulna. We have a radial tuberosity. We have the interosseous margin. And then distally, we see that the anterior distal surface is smooth and concave, versus the posterior distal aspect is rough and convex. So this is posterior, this is anterior. This is called the styloid process of the radius. This is a right radius. The styloid process always goes laterally. This is anterior, this is lateral, this whole end's distal. So this is a right radius. A right radius. The carpus. This is a right hand. This is a right hand. So if we go laterally on the proximal row of carpal bones, this is the pisiform bone, then the tricutral. Some say tricutrum, triangular. It's all the same bone. Then we have the lunate and scaphoid. The two bones that articulate with the radius is the lunate and scaphoid. And again, this is a right radius. This is a right carpus. Distally, we have the hamulus on the hamate bone, the capitate, which is the largest bone of the carpus, and then the trapezoid and trapezium. So hamulus, the hamate bone, the capitate bone, the trapezoid, and the trapezium. These are called metacarpal bones. You have metacarpal 1, 2, 3, 4, and 5. They have a body, a base, and a head. These are the phalanges. Notice the thumb has only two phalanges, a proximal and distal. The other digits 2, 3, 4, and 5, have a proximal, middle, and distal phalanx. Again, that's the carpus. Next we have the pelvis, or actually this is half of a pelvis. It's not a whole pelvis, it's just half. It's called a hemipelvis. This is actually the right hemipelvis. This is called the acetabulum. This is the obturator foramen. This is the ischiatic tuberosity. And so this always goes, this is what you sit on. This is your butt bone if you sit on it. So this always goes posteriorly. This is your pubic bone. This goes anteriorly. So you can see this is a right hemipelvis. This large bone here is called the ilium. This is your iliac crest. We have an anterior superior iliac spine and an anterior inferior iliac spine. We have a posterior superior iliac spine and a posterior inferior iliac spine. This whole thing is called the wing of the ilium, or the ala. This is on the medial side called the iliac fossa. We have a greater sciatic notch. We have the auricular surface for the sacrum. And although not shown on this model, we have a ligament that runs from the pubic tubercle to the ASIS. This is called the inguinal ligament. Posterior bone, we have the ischium. This is ischium. We have this ischial spine, which is here. We have the ischiatic tuberosity. We have the lesser sciatic notch, which is here. This is greater sciatic notch. This is lesser sciatic notch. And then we have the pubic bone. This is the pubic bone. Pubic bone. We have the pubic tubercle. We have a superior pubic ramus and the inferior pubic ramus. And we have a groove right here called the groove for the obturator nerve. The obturator groove for the obturator nerve. Back to the acetabulum. This is called the lunate surface. This is the fossa. And this is the acetabular notch right here. Our next bone is the femur bone, and it's a huge bone, so it may not all fit on our video, but we'll go one end and the other. This is the femur. This is a left femur. This is the head. On the head, we have this indentation called the fovea capitis. The round ligament attaches here, which also attaches to the acetabulum. We have a greater trochanter, which is cracked off this bone a little bit. We have a lesser trochanter. We have this intertrochanteric crest. We have the neck of the femur. This whole part here is a shaft. This is the shaft of the femur. Come on, move. This is the shaft of the femur. These lines on the posterior aspect are called the linea aspera. This is linea aspera. We go on the distal aspect of the femur, and this is a posterior surface. So here's the popliteal fossa. Here is the medial and lateral condyles. We turn it over to the anterior surface. This is the patellar fossa. On the medial aspect, we have this bump called the adductor tubercle, which is where the adductor magnus muscle attaches. So you'll need to know that. Okay, our next bone is the patella. And this is a small bone, so we get this all on the video. This is the patella. Now, patella has a base and an apex. A base and an apex. This is the external surface. This is the articular surface. If you lay the patella with the base toward you, the apex away from you, you lay it flat on the table, it won't sit flat. Notice it falls to one side or the other. So base toward you, apex away from you, okay? The side that falls down, it is that patella. So that makes this a left patella. The left side falls down. See, if I set it flat, the left side falls down. It's a left patella. If we use another example, here's another patella. Again, this is the base, this is the apex. Set it flat, that is a right patella. A right patella. Our next bone is a tibia. This is a tibia. It's been dropped, so it's a little bit moth-eaten looking. But this is a tibia. We have the condyles of the tibia, a medial condyle and a lateral condyle. The lateral condyle has a roughened surface called Gerdy's tubercle. If you look here, there's this intercondylar eminence with the medial and lateral intercondylar tubercles. There's a tibial tuberosity for the insertion of the quadriceps muscle. There's a shaft with this interosseous border, the interosseous membrane. And then distally, the distal tibia, we see this projection. This is called the medial malleolus or malleolus. It always goes medial. That's your medial ankle bone. That always goes medially. Then we have this notch here for the fibula called the fibular notch. So that makes this a left fibula. Excuse me, a left tibia. I'm so sorry, left tibia. This is a left tibia. Our next bone is a fibula. This is the head of the fibula. This is the head. Okay, just the head. And then really there's other components here, but I want you to look at the distal aspect of it. This is the lateral malleolus or malleolus. This is the medial side. This is the lateral side. And how to tell a right from left fibula is find this fossa. This fossa always goes inferior, posterior, and medial. So inferior, posterior, and medial. That makes this a left fibula. A left fibula. Inferior, posterior, medial. So find this lateral malleolus, put it inferior, put this back and this inward, and it makes this a left fibula. Last set of bones here is the tarsus. And we'll put it hopefully where you can see this. Several bones here. This is the talus. This is the calcaneus bone, or your ankle bone. And I'm going to show you this bone separately here. This is the calcaneus bone. Now, if you put the calcaneus facing toward you, face it toward you, where the tuber calcanei is posterior, you put this surface on the table, the articular surface superior. This is called the sustentaculum tali. The sustentaculum tali always points medially. That makes this a left calcaneus. So this is tuberosity, sustentaculum tali, always points medial. This is a left calcaneus. Okay, back to our articulated tarsus here. This is called the navicular bone. These are called cuneiforms. You have a medial, intermediate, and lateral cuneiform. And then this bone is called the cuboid bone. It's kind of cube-shaped, cuboid bone. It's on the lateral aspect of the tarsus. Again, this is the talus. This is the calcaneus, cuboid, lateral cuneiform, medial cuneiform, intermediate cuneiform, and in the medial cuneiform, and this is the scaphoid or navicular bone. You can call it either one. Navicular is more common. These are the metatarsal bones. Metatarsal 1, 2, 3, 4, and 5. Metatarsal bone is 1 is medial. This is the big toe. You can tell one has 2 phalanges. The other toes have 3 phalanges, just like the fingers do, the digits. This is the 5th metatarsal bone. And I want you to notice here, this is called the tuberosity of the 5th metatarsal bone. It's going to be important to us later on. Several muscles attach here. We'll talk about this later on. So this is the 5th metatarsal bone, tuberosity of the 5th metatarsal bone. That is Lab 2. Thank you.